Well, thank you for inviting me to come. Thank you for so many of you turning up. I know Paul Nurse is talking downstairs, so I feel some pressure. Hopefully I don't disappoint. So yeah, I'm going to talk about a piece of work we did earlier this year looking at the mental health of researchers from mental health in academia. And I thought I should first take a couple of minutes just to introduce myself. You probably haven't heard of the place I work for, so I thought it'd be worth just introducing that first. So I'm a researcher at RAND Europe, so the official spiel is that we're for a not-for-profit policy research organisation. So what that means is we do a wide range of policy-oriented research. A lot of it is contract research for government departments and other relevant public policy bodies. And really the aim of what we do is to provide non-partisan, evidence-based research to support decision-making analysis in government and in policy organisations. So we're part of the wider RAND Corporation, which you might have heard of if you've seen Dr. Strangelove, or if you're from the US, but we operate independently here in Europe. We have our head office in Cambridge. We've also got a small office in Brussels because we do a lot of work for the European Commission too. And we do a wide range of different topics. So we do policy research on defence policy, we do employment policy, social policy, health, education, you name it, we do it more or less. My particular area of interest is research policy, so you can call it science for science or research on research, or so basically what I do is do some work looking at the research system itself. So it can be things like how research is effectively translated into practice, how research systems are effectively governed and organised, things about how we communicate the value of research to funders, which can be very important, also to the public, and how research interacts with society. So that's kind of the broad area I work in. A particular strand of that is around the research environment as a workplace. So we did some work towards the end of last year and the beginning of this year on research and mobility, which is obviously very topical, and this mental health work sits within that portfolio. And so if you are interested in RANDs or want to know how I went up from being a physicist to doing this, then please come and ask me about that afterwards. But I'll kind of move on from that now and get on with the topic in hand. So I just wanted to firstly start by setting a bit of context for this. So I suppose you're probably all aware that there's been an increasing focus on mental health in universities. So there's been a lot of reports in the press about the idea of a mental health crisis, particularly amongst undergraduate students. So there's been rising suicide rates, I'm sure you're very aware of here in Bristol. Also, other outcomes like dropout levels amongst undergraduates have been rising too. What's been less well covered or considered perhaps is if this is such a stressful and difficult environment for undergraduates, what does that mean also for people who are either postgraduate students or who are working as part of the staff here at universities, and how are they affected by that environment and working in that setting? And I just wanted to flag this. I don't know if this was doing the rounds on Twitter earlier this week. It's a piece that was in the Irish Times on Tuesday. I don't know if anybody saw it, and it's about mental health of PhD students in particular. And there was this guy. How it starts is it describes this guy who published a paper and had some issues getting it published because of the comment he put at the beginning in the acknowledgement, saying that he was dedicating it to one of his colleagues who had actually committed suicide based on the stress of his experience as a postdoc. And I just thought, that really flags up that it's starting to actually, this is an issue that's starting to gain some attention in the press, and I think in wider circles. And given that, what we were asked to do is the Royal Society and the Wellcome Trust came to us, and they wanted us to have a look at what the existing evidence was in the literature about mental health in research environments. And really what they wanted to do was sort of understand what is known already. They wanted to kind of raise the profile and understanding of the topic, so to try and get on the agenda alongside undergraduate students, so that people were starting to think about universities as a whole rather than just the student end. They also wanted to understand how they could design more effective interventions to support mental health in universities, and also really to understand what's needed in terms of research in this space. That was really the aims of our study. And we had, I've gone too far. Oh, no, I haven't. We had a set of research questions to support that. So these are listed on the bottom, slightly going off the screen, sorry. So how are mental health and well-being understood in the context of research environments? What is currently known about researchers' mental health and well-being, and does it differ from that of other populations? What interventions are used to support researchers, and what evidence is there of their effectiveness? And what are the strengths and limitations of the evidence base? So those were our sort of guiding questions for the study. I won't spend a long time on methods, but just briefly. So it was a rapid evidence assessment, so I don't know how familiar you are with that method, but it's basically, it's like a systematic review, but something that you have to do with slightly more resource constraints. So it takes this systematic approach, but we have constraints on the scope and inclusion criteria that allow you to then complete it in less than the very long amount of time it can take to do a systematic review, as I'm sure some of you know. We had primarily a UK focus, but we also took in literature from comparable research environments, so Europe, North America, and so on. And we have identified 159 studies for a full text review, and then ultimately included 48 in the final review. About 3/4 of those were survey-based studies, so that raises a couple of caveats. So firstly, there's quite heavy reliance on self-reporting the data, so that has some challenges. There is some literature to suggest that when people are representing themselves as a particular type of employee or representing a particular group, they may slightly over-report relative to a general population survey, so it's better to compare to other working environments rather than to general population studies in that context. There's also issues around causality, that it's not easy to bottom out in these kinds of studies if you're on a self-report survey. So is the level of stress in the working environment a factor of the working environment itself, or is it related to the characteristics of people who work in that working environment? There's a lot of evidence to suggest it's the former, but it's hard to prove that. And then some of the key data sets, particularly on PhDs, are from outside the UK, so there's quite a lot of work been done on PhDs in the US in particular. So a lot of what I talk about will, in terms of the PhD context, will be focused on US-based evidence. So what did we find? Well, the top line heading is that survey data indicate the majority of university staff found their jobs stressful. So there was a number of different surveys looking at this, but one that's worth picking up is this very large-scale survey that was done of members of the UCU, so that's the University and Colleges Union. There's nearly 15,000 responses from universities across the UK. And in terms of that, 3/4 of respondents agreed or strongly agreed with the statement that I find my job stressful. About half said their general level of stress is high or very high. More than a third often or always experience levels of stress they found unacceptable, and only 2% of respondents never experienced unacceptable levels of stress at work. So this shows that generally working in the university environment, it's a stressful place to work. Looking at postgraduate students, there's evidence from the US, as I said, that large proportions, more than 40%, depending on exactly which study you look at, report symptoms of depression, emotional stress-related problems, or high levels of stress. So there's an indication that the university environment is a very stressful place to work. And we can compare that to other places of work, and that still holds. So levels of burnout, which are defined as prolonged response to chronic emotional and interpersonal job stressors, we find they're higher amongst university staff than in general working populations, and comparable to some high-risk groups like healthcare workers and so on. And the proportion of university staff with a risk of having or developing a mental health problem is higher than other working populations, so higher than people in education or health and social work. So it's quite high, basically. What's more difficult is then to link that through specifically into mental health conditions. So a lot of surveys will capture information on stress, but what there isn't a lot of is kind of clinically verified objective measures of specific mental health conditions. One of the best sort of substitutes for that there is in the literature is this GHQ-12 tool, which some of you may be much more familiar with than me if you're working in the field. This is a kind of a well-validated screening instrument to look at psychological distress, and it's well correlated with common mental health conditions like depression and anxiety. Using the GHQ-4 rating, which is sort of the most stringent version of the test that's typically used across 3 studies, we find that somewhere around 32 to 42% of researchers at universities are at risk of having or developing a mental health problem. So the evidence suggests that the levels are potentially quite high, and again, here it shows, reviewing across occupational groups, that the risk amongst university staff is higher than social service staff, teachers, and other relevant populations. However, by contrast, if we look at the proportion of staff that disclose a mental health condition to their university and report it, that's much lower at 6.2% now. What that probably suggests is that there's a level of stigma associated with reporting mental health conditions, and that's what we commonly see in the wider literature around white-collar professions, that people don't tend to report mental health conditions when they have them. Yeah, sure.
I didn't quite catch what the 32 to 42% refer to. Is this general population, or is this universities?
So that's university staff.
Okay.
Yeah, that's right. And so quite a lot lower proportion report than we see in these self-report surveys. So that could be partly a factor that people are more likely to say they have a condition in these kind of surveys. So there may be a level of over-report in the surveys, but equally it's probably a level of under-report in the disclosing to the university. So I think probably the true situation sits somewhere between the two. So moving on to working conditions, one framework that's been used in a number of the studies, including that large survey that I spoke about earlier on, is the Health and Safety Executives Management Framework, and it gives you these 6 different areas of working conditions that can contribute to stress in the workplace. And actually, this is supported by the wider literature around the topic as well as potential issues for workplace environments. I'll go briefly through the different areas. So there's demands, which is issues around workload and working patterns, so how the demands that your job places on you in that sense. There's control, so the extent to which you have control over the way you work in your working environment. There's support, the level of support you have from the organisation, managers and colleagues, the extent to which you feel you're valued and supported by the place that you work. Relationships, and particularly the promotion of acceptable behaviours in the workplace, so things like bullying and pressures and so on from other people. There's clarity around your role and the way that it fits into wider organisational goals. And then finally, how change is managed in the organisation and the extent to which it's communicated and people feel that they are involved in that decision-making process around change. So those are all areas which can contribute to stress, and we find that amongst people working in the university environment, they generally perform worse than most different sort of comparable professions like education, social work, healthcare work on 5 out of these 6 categories, and I'll talk through those briefly. So the ones in the red are the ones where universities are doing worse, and I'll talk through that briefly. So in terms of demands, people in universities work very long hours. I'm sure you all know this. Most work more than 40 hours a week, and about 40% are working more than 50 hours a week, so going beyond European time directives and so on, so really beyond what could be expected reasonably of them. And it is associated with high levels of stress in a number of studies for people working in universities. In terms of levels of control, findings are a bit more mixed. So people do seem to have a sense that they have a good control over their day-to-day, what they do day-to-day. They can take a break when they need to. They have some control over what they do, but they don't necessarily have a wider control over their role within the system, linking through into issues around change management, for example. In terms of support, there's significant variability in the level of support provided for people within universities, and that's perhaps linked to different levels and quality of management provided, depending on who you happen to work with or for. So that's something that's notable. In terms of relationships, I found these results quite surprising. So 54% of people who reported that they'd had experience of personal harassment, nearly half, so 48% of people said they'd had experiences of bullying, and there was somewhere around just under 10% had persistent experiences of both of these. So that suggests that there's significant concerns about the way that personal relationships are being managed in the university workplace. In terms of role, people generally had an understanding of what they were supposed to do on a day-to-day basis, but people weren't always very clear about how their role fit into the wider organisational goals, was the general finding. So they don't necessarily have an understanding about where they fit within the wider goals of the organisation they work for in the department. And then finally, in terms of change management, about half of respondents to the large survey found that the change was often introduced without a rationale or a clearly explained rationale at least, and many felt that they weren't consulted or adequately involved in decision-making processes around change. Having said that, there are elements of academic careers that are protective. So for PhD students in particular, there's a sense that understanding the value of your PhD work for your future career is really helpful in terms of protecting against stress, as is having confidence in your ability to do the work that you're doing. More widely, researchers who spend a larger proportion of their time on research rather than other administrative and teaching duties tend to have lower levels of stress and a higher satisfaction with their work. But generally speaking, broadly, people working in research generally find that they have a lot of satisfaction from their work. They gain intrinsically the work is enjoyable and they see the value in that. It's just when that's played against other factors around the working conditions that some of the issues come in. One group that's at particular risk of mental health conditions, which is covered in the literature, are those researching sensitive topics. So this can result in what's called vicarious trauma. So if you're working with people who are reporting traumatic experiences to you, then that means that you might then experience some of that trauma for yourselves and that may result in some stress or emotional difficulties. So that's particularly flagged up in areas like nursing research, public health research, and studies of sexual violence, for example, in the literature. And one of the studies commented that in the course of the very proper concern of researchers to protect research participants from harm, researchers have neglected to protect themselves. So the overall message from the publications in this area was there was need for more consideration in research design and in research oversight of the needs of researchers working in these areas. And there was also some comment that other comparable fields like media or international aid organisations where they have some similar concerns around this are much better at managing the risk to the people involved than the researchers are. So need for some improvements in that area. So moving on from this, just reflecting from a university perspective, beyond the obvious negative impacts on the individual, there's some significant impacts at the organisational level from poor mental health and wellbeing in universities. So the first would be around reduced productivity. That can be through absence, but more commonly through presenteeism, where people continue to work, but their ability to do their work is decreased significantly by the mental health conditions that they're suffering with. We also are issues around low levels of commitment, so this can manifest as like high levels of turnover, but could also be negative attitudes in the working environment where people don't feel supported and don't feel committed to the place that they're working. It can also spill over into effects on personal and family life, which can be significant. And estimates around the costs are not yet well characterised, but based on one particular study and extrapolating from that with a number of assumptions, it could be that the costs of the higher education sector are very high, somewhere around £500 million per year, resulting from poor mental health and wellbeing in the sector. And of course, there are potentially much wider costs to society as a whole if people are not working to produce the research innovations and new ideas and things that support our economy, and also people, perhaps who are doing PhDs don't complete those and move out of research, and then that's also a very significant cost too. We also looked at what interventions there are available to support mental health and wellbeing in universities, and what we find is the evidence there is very limited. So most studies focus on interventions that were really focused very much on addressing the symptoms rather than the causes. So things like, providing a mindfulness group or, counselling services to address the symptoms rather than the reasons that stress is there in the first place. And even where that had been done or reported in the literature, the evaluation methods were typically fairly poor quality, so it's hard to say whether those interventions are actually effective. Equally, most interventions have only been tried in very specific settings and often with only very small groups of individuals, so that limits the replicability or generalisability, I guess, of the findings to wider settings. Also, many of the interventions we looked at were targeted at university staff and typically covering also undergraduate students, so it's hard to know what the effect is on researchers, particularly from those. Building on what's in the literature, we developed a typology of interventions across 3 different levels, which we thought was useful in terms of characterising the difficulty and potential impact of different interventions that could be introduced. So at the first level, there are interventions that address workplace factors that impact on mental health. So that's really trying to address the root causes. So that would be those are the most difficult things to address, but possibly the most effective things, arguably, although that's obviously not been tested. So that would be things like tackling the whole working environment that leads to job insecurity, so how academic careers are structured, those kinds of things that are very difficult to address, sort of at the systemic level. The second level of interventions are around improving policies and addressing stigma around mental health for those working in the university workplace. So that would be things like making sure universities have an appropriate policy, that's implemented across the whole institution, that people who are managers know how to deal with mental health conditions when they arise, and so on. And then the final level, which is the easiest and the most commonly seen in the literature, but again still not well evaluated, are those kinds of interventions that provide support for groups of individuals, so the provision of counselling service, for example, which is of course valuable, or those that more generally improve well-being, so some of the things I talked about, like having yoga and things, which is potentially nice, but maybe isn't getting to the root causes. So, what can we say? Well, overall, some of the challenges in the research environment aren't unique. I mean, having an insecure job and working on a 0-hours contract is just as challenging whether you're a researcher or you're working in a supermarket. But what we can say is that the conditions within the research environment that come together are somewhat unique when you bring them all together in the round. So these are some of the characteristics we think overall sum up some of the challenges and benefits to working as a researcher in a university. So first of all, you've got high proportions of staff who have short-term contracts with limited opportunities for progression. There's a culture of long working hours with pressure to deliver and significant potential for overlap between work and home life. There's a need to balance a mix of commitments, so research, teaching, administration, some of which you may like more than others. There's a wide variation in the standards and styles of leadership and supervision, and there's very little management training for people who are leaders, which can lead to increases in that sort of diversity of standards. Although there's a high level of control over personal working environment and day-to-day tasks, involvement in organisational decision-making by research is typically quite low. And then finally, work itself is stimulating and meaningful. And what this means is that you see some interesting effects. So we saw in some papers that high levels of job stress could coexist with very high levels of job satisfaction. So you love your work, you're very passionate about that, but actually working 50 hours a week is still stressing you out, and those things can exist together. So I think there's something about the research environment and the way it brings together different positive and negative factors that are actually quite unique. And with that in mind, there is a need for more research on this topic. So surprise, surprise, the researcher says we need more research. I'd get in trouble for this at work. But anyway, I thought you guys might be sympathetic. So, so I think there's a few things that we flagged as kind of major topics to look at. So the first would be to just understand what support is available. It's really not clear the extent to which different universities have even a policy on mental health and where they exist, to what extent they're implemented. So I think just mapping what's available at universities and trying to understand what the standard of provision is already would be a really useful first step. A second thing that we talked about was the possibility to develop or build on a framework to provide some comparable data and standards. So one framework would be that HEFCE framework. So that would be the 6 characteristics that I talked through as part of the talk, but there are other ones. So there's something called Mindful Employer, which has been used across a number of, not really universities, but other employers as a kind of set of standards and practices around mental health that people can sign up to. So there are some things that are already existing, but it'd be good to see how that works in a university setting, perhaps pilot it with the university and test it out and adapt it as needs be. There's definitely a really big need for more and particularly higher quality evaluations around mental health interventions in the setting. Particularly, in my opinion, those that tackle root causes or at least try and get beyond the sort of what you might call tokenistic things around, you know, a yoga session. Well, that's fine, but I'm still working 50 hours a week, so thanks for that, kind of things, which I think can be annoying rather than helpful sometimes, potentially. And then, really importantly, there's a need to get some of that published. I have a sense that there's a lot of things going on at institutions as pockets of good practice, but actually people aren't willing or able to make that publicly available. And that sort of goes into the next section, which is I say there are some things that can be done in the meantime while we're waiting for more research. And I think at an institutional level, it's really important that universities become a bit more open about this as an issue and recognise that actually this is a sector-wide issue. We need to be open about this. We need to publish data. I think universities are very scared of making it clear that there may be a problem with their institution. They're scared of what that might mean. They're scared of not having a response to that. And I think if we can recognise it as a sector-wide issue and universities can share data, share best practice, learn from each other, then actually that's going to help us make a lot of progress in this space. I think this is important too, so increased reflection on staff as well as student mental health. I think there's been a lot of focus on student mental health, and that's great, but actually we need to think about the university as a whole. And then focus on cause and culture underpinning stress and their well-being rather than necessarily just trying to make people feel the better when they're already stressed out and not doing so great. At an individual level, I should say this is not particularly evidence-based. This is my reflections on the individual level because that's not really what we looked at so much, but I think there is a need to make yourself aware. So, you know, how do you recognise when people are struggling? What support can you provide them on an individual level? How should you talk to them about it? I think, you know, there's scope for us all to do that. Be sensitive, be forgiving, be kind. You know, you don't know what's going on in people's lives. Give them a break. I guess be a nice person. And then, on a personal perspective, you know, look after yourself. Reflect on your working conditions. Is your work interfering with your home life? Are you working 50 hours a week? What can you do to address that? Is there support that you can get to? And hopefully at the end we can get into discussion about, you know, your personal experiences as well, if people are happy to do that. So just a couple of slides to finish up. So I was really surprised and great to see you all here. This finding seemed to have really resonated with the academic community. So we had a piece in The Guardian and some bits in Time Tire, but actually what was really noticeable was the response on social media. So this was really picked up, and lots of people giving quite personal accounts of their experiences. The blog that we did, all the comments below, people just really, I think it's really resonated with how people are experiencing their own working lives and the stress that they're under. And actually, I think it is starting to be taken seriously at a sector level by policymakers and funders. So we were invited to present the findings to a working group with HEFCE, Universities UK, Wellcome Trust and the Royal Society, and they were interested in starting to develop an agenda around this topic. Following on from that, HEFCE have commissioned a study on issues around prevalence and some perspectives at a number of universities, which I think is ongoing at the moment. And I also saw that recently Universities UK have released a framework on mental health, which admittedly is still very much focused primarily on students, but they do talk about a whole university approach and taking it in staff too, which is a great step forward. So I'm really pleased to see that out. Okay, so that's enough of me talking. I'm very happy to answer questions on the study if people want to do that, but I also wanted to just be able to open up a wider discussion. You know,